Hi everybody, it's Anthony Lowe, the Physio Detective here, and I've got with us Christy, Kelly and Suzanne. And this is the second little group hangout that we've got. This is not an official physical therapy consultation. This is just a bunch of four friends getting together, sharing information about exercise and just some of the things that I might do. This is not necessarily specific for their presentation. We're just happening to accept their volunteering to demonstrate some of the concepts that I'm going to be talking about. Are you girls all good with that?
Yep. Yeah, that's a good disclaimer.
All right. We'll start with Kelly. Kelly, just tell us where you feel some of your symptoms and what you hope to get out of today's session.
Sure. I usually feel symptoms in my glutes and my abs and diaphragm. Sometimes a cramp in my calf. I'm hoping to learn to balance my muscles a little bit better as far as posture and my gait goes. Maybe if I can improve on that, then my muscles won't get as tight.
Okay, so posture, gait, and balancing your muscles. Would that be fair?
Yep.
Okay, excellent. I'm going to put Suzanne on the screen. Suzanne, hi. Tell us just briefly about what you'd like to get out of today's session, where your symptoms might be right now.
Well, my symptoms are primarily I feel that there's a non-synchronization between my floor and my diaphragm. Kind of a disconnect. Sometimes when I'm walking, like I went for a long walk and my body's up, kind of in a fight or flight kind of a thing. And in the middle of where it feels like where my diaphragm is, and it goes up from here into my diaphragm area. And I don't know where that's come from, but it's just weird. And I think that it might have something to do with my breathing, but I'm not sure.
Okay, cool. So
I thought maybe we'd take a look at maybe, breathing or the rib cage position or whatever.
okay, so that sounds like posture and breathing again. So
okay.
I'm good with that. Okay, and Christy, we dealt with your right hip last week, and we did some things to do with centering of the femoral head. And I think we discussed earlier that we want to progress that into walking, and I wanted to do sit to stand. Was there anything else that we wanted to progress on from that?
No, that's exactly it. I feel like I understand how to do it in supine, but getting more functional and being able to integrate it into my life so some of the muscles around my hip don't bother me.
Okay, that sounds fair. So just because I'm slow, I've got posture, breathing, muscle balance, sit to stand, and walking gait.
Yeah.
Was there anything else? Kelly, was there anything that I missed for you?
No, I think that sums it up. And those other problems that they mentioned, I'm also interested in. So.
Okay, cool. So why don't we start with posture, and we'll start with you, Kelly, and then we'll get to Suzanne about posture. So I'll just get you to stand and face to, that's very good. That's, okay, good. Can you turn yourself around to the left for me, thanks? 90 degrees. Fantastic. Now, do you have any belts or anything on?
No.
No? Okay, cool. All right, so just look straight ahead for me and just listen if you can.
Whistle?
Okay, sorry. I said just look straight ahead and listen.
Oh, listen. Oh, I thought you said whistle. Okay.
Yeah, no, that's good.
Okay.
Okay. You're out of the picture for me at the moment, Kelly, so step back a little bit, thanks. Okay, yep. Now, Face to the left for me, thanks. Excellent. And just stay still. Okay. So, what do you think about your posture?
I feel some tension in my right knee, and
Can you point to where, please?
in the kneecap.
Uh-huh.
And a little bit of tension back here.
Okay.
And it's hard to stay standing still for any amount of time for me.
Okay, and what makes it difficult to stay still?
It just doesn't feel like my weight is distributed right.
What can you explain what that means, please?
Well, so I have the tension in my right knee, and I get fatigued very quickly if I stand for any amount of time. I'm not sure how else to explain.
Okay, that's okay. Can you do me a favor? The way that you're facing, let's call that 12 o'clock. Can you turn to 11 o'clock for me, please? Just a little bit to your left. Okay, that's good. Can you come back towards 11:30 for me? Because you're almost there. Ah, there you go. That's perfect. Thank you. You're now square to the camera. Before that, it was hard to see. Can you just tighten your shirt at the front for me? Yep. And now can you tighten it at the back? So pull it for. Yeah, I just want to see what your spine looks like. There you go. All right, let's leave it with that, I think. Okay, so basically what we can see is that your thorax is your rib cage. And look, to be honest, it looks like it sits over your pelvis okay. It's very, very hard to tell on video, you know. But the whole thing looks like it's forward, just a little bit forwards. And so I don't know. I'm going to guess that your back muscles are working really hard right now. So feel your back muscles for me, please.
Here?
Yeah. How do they feel? Hard, soft, or whatever?
I'm not sure about the hardness. They do feel a little bit tender when I touch them.
Okay, well lean backwards for me. Just lean backwards. And how does they feel now?
It's hard to lean backwards.
Why?
I don't feel very flexible in that direction.
Okay, well you don't have to go very far. I just want you to lean backwards a little bit.
Just a little bit, okay.
Yeah, what happens to the muscles there?
That's a little bit better.
So they're harder, softer, less tender, more tender?
Less tender.
Okay.
I'm feeling it in my knee a little bit more though.
Okay, that's good. Can you bend forwards just a little bit as if you're going to brush your teeth a little bit? You know, like you didn't want to drip down your shirt. That's it. Feel your back for me now. Tell me how your back feels.
Now the muscles feel a little bit more like they're working. They don't feel tender.
Okay. All right. That's good. Come back to standing normally. Thanks. All right. In your feet, where do you feel the pressure of the center of your weight? Like, where in the foot does it feel like all the pressure is?
I would say mostly in the ball of my feet.
Can you
and
point
toward the middle?
Can you point to where that is for me, please?
So here, can you see that? Do I need to turn?
Yeah, no, that's good. You're good. You're good.
Okay. And more on my right side than on my left.
Pardon?
And more on my right foot than my left foot.
All right. So all I want you to do, like I think your posture's not too bad. I can't tell because I'm not there with you in person. You look a little bit uptight. I would say a little bit uptight. So Yeah, just a little bit tense. So what I want you to do is just take the weight off the balls of your feet and kind of put them where your shoelace knot would be ordinarily.
Okay.
Yeah, that's it. That's it. So that should be
Oh,
right in the front
better.
of your shin.
Okay.
How do you feel?
I think that does help, but I'm still feeling a little bit in my right knee.
Yeah, okay, we'll get to him in a minute. Just touch your back for me, thanks.
Okay.
How does that feel now with the weight more centered in the foot? It should be in the center of your foot, in the center of your arch.
That's better, I would say.
Good.
Yes.
All right, that's a good start. So just have a rest for now. We'll get Suzanne, who looks like she's just taken a comfortable seat. I'm going to get you to stand up, Suzanne, and we can look at your posture and your rib cage.
Okay, let me see if I can do this where you can see me. Okay. Can you see me?
Yeah, is that a laptop, Suzanne?
No, it's my iPad on my laptop. My laptop's holding it up.
Okay,
Let me see if I can do it.
just less tilt. If you can tilt it more upright, that'll be better for me, please.
Okay. Please. See if that holds.
That's much better, Suzanne. Much better.
Okay.
All right. Yeah, I was going to say choose carpet or whatever that is. That looks like a mat. That's cool. All right. I'll get you to face to your left as well, thanks.
That.
Yes, please. Okay. Can you tighten the shirt at the back for me, please? So pull your shirt to the front. Yeah. And at the bottom, it's sort of hanging a little bit at the back. I need you to make it tighter around your bottom. So just pull it at the front some more. There you go. That's it. All right. If you get really fancy, you can tie that up in a knot and it might stay like that.
I can just take it off, huh?
It's up to you. You are being recorded.
Kidding. Wait. Well, it's not going to work. Let's see.
Do you have a
Might have an-
Do you have a singlet do you have a tight singlet that you can go put on?
Let me see.
Cool. All right. Christy, we'll get you to
Yes.
stand up and show us your posture if you don't mind.
What kind of shirt do I need to be wearing?
Oh, well, I don't know. What you got Seahawks on. We can go get you to put a Green Bay Packer or
Oh,
a
no.
Patriot shirt on or something. Would you prefer that?
No.
Let's have a look.
I have a loose shirt on.
Is this better?
Yeah, we're just
I'm up in our guest house, granny flat, and so I only have a couple of things up here.
right. That's going to be better. We're just looking at Christy real quick.
Okay.
Because you know you ran away for a moment
okay.
there. That's okay. So
Right.
just you're doing really well, Christy. Okay, step to the left, please. One more big step, like 2 feet. All right, there we go. All right, that's not too bad. You still got a little bit of a sway going on. If you tighten the shirt at the back for me, please, so that we can see your spine. Ah, there we go. Beautiful. So you can see that the weight is like the greater trochanter is here. Now I'm doing this for the sake of the video because hopefully you can see my cursor. You won't be able to see it right now, but you will on the video. And we want the greater trochanter to be basically in line with the front of the shin or where these shoelace knots are. And then you want the shoulder here to be over that. And then you want the mastoid process to be over the shoulder. And in Christy, you can see that her head's a little bit forward. Christy, what I want you to do is just to slouch your upper body a little bit because that's not bad. Sort of flex forward more. I'm just going to get you into a bad position. I need you to roll forward more. So you're pushing out the back. So just go back to your normal posture. I'll start you again. Okay, so what I want you to do is to roll your shoulders forward as opposed to leaving them in space where they are. So actually forward flex from your lumbar spine more. That's it, stop there. Okay, now stand up straight without moving your back, your lower back. That's it, good. Now you're in a forward lean. Now what I want you to do is just to bring the whole thing back as a unit to center balance. And then relax. Good, okay. So you can see, girls, that she's got her torso angling backwards. I want her torso, so basically underneath, basically where the underwire is, down to the hem of her pants, it should look like a can of Coke. And at the moment, it looks like the can is crushed a little bit at the back. Can you see that? That's Kelly and Suzanne.
It's hard to see because she's in the little picture still.
Oh, well, if you click the big picture, she'll come up in the big picture.
Oh,
So,
okay.
yeah. So can you see what I'm trying to get her body to look like is a can of Coke right in that waist area. Okay, so Christy, just drop. I want your chest a little bit more forwards in general.
My chest?
Yeah. Okay, okay. Go back to where you were. So what I'm trying to do is just basically use words to get the reaction that I want. I want you to, that's good. Whatever you're doing there is good. Now just grow taller for me, please. Grow taller. Head to the ceiling. That's better. So can you see how her torso is now elongating? That's what we want. We want this to look like that somewhat. And now just relax without losing your spinal position. Good. How does that feel for you?
Feels fine.
Okay, stick your hand out in front for me, thanks.
My hand?
Yeah, one arm straight out, as in forward flexion. Use the left hand and push down on the right one and tell me about the strength. How does that feel?
Good.
Yeah? You're pushing down hard?
Yeah.
Good. Okay, stand how you normally would have stood. Yep, I'd agree with that. So I don't know if you can see, girls, Kelly and Suzanne, but she's leaning backwards a little bit. So put your arm up there and retest. How does that feel?
Similar.
Yep. Okay.
Yeah.
All right, good. That's your posture. We'll get Suzanne on the line. You're going to have to unmute your microphone, Suzanne.
Okay, just hold on a second because I'm getting a new shirt because you can't see anything in this one.
Oh, okay. No problem, no problem. What did you think of that so far, Kelly?
It reminded me that my shoulder strength is often a problem, and so I think that would be a useful exercise for me to do.
Well, while we're waiting for Suzanne, do you want to just jump up and try that now?
Sure.
So just how you normally would stand. Do the shoulder test. So at the wrist is better. At the wrist is better, Kelly. Yeah. So that's how you normally stand. Push down hard. How does that strength feel?
Yep, it feels okay today.
Yep. Okay. That's good. And then just change your posture just that little bit. Put the weight in the center of the foot. Tell me how that feels.
Okay. See. It's a little bit better, not too much different.
Okay.
My shoulder doesn't seem as out of whack today as it often is.
And that's something that you can try, you know, like I can't guarantee that it's going to work for you, but it's something that you can try. All right, Suzanne, did you get your different shirt?
I think so.
Oh, much better, much better. Just for consistency, I'll get you to turn to face the other way if you don't mind. That's good, thank you. And just pull the shirt just a little bit tighter at the back for me, please. There's a bit of a lag going on, I think, with your video. Okay, that's it. Now, you can see with Suzanne, I'm just going to talk about you here, Suzanne. I apologize.
That's okay.
So you can see with Suzanne that she has the classic I'm trying to stand up straight posture, and it goes into an excessive amount of extension. So you can see that her tummy and her hips go, well, her tummy goes forward and her shoulders come backwards a little bit. And what that does is it creates a lot of tension, like a lot of effort at the back, and then a lot of tension at the front because it wants to balance all of that out. So what I want you to do is just do the arm test for me, please, Suzanne.
Tell me what that is because I don't remember what it was.
Oh, that's okay. So stick one arm out. That's it. So right arm out. And then you use your left hand on your wrist. And you want to push all the way down. Hi, Linda.
Linda.
Okay.
Linda's muted.
Linda, you got to unmute your microphone. So, Linda, the microphone is at the top. And it's next to the video. Oh, I think you're unmuted. Can you say something, Linda? Okay, perhaps you don't have a microphone on your computer, or you but I can't hear you, Linda. So you
If
can.
she presses her screen, she presses the screen, the icons come up.
Yeah.
If she's on an iPad.
Yeah.
That's how it was on my phone too.
I think she just sent. Oh, settings issue. Yeah. Okay. Well, keep working on it. And speak up, and I will tell you if I hear you. All right. So I just replied to that on Facebook as well. Isn't technology brilliant? So what we're up to is, Suzanne, you're doing the posture for us. Do the arm test for us. Tell us how it feels. You're gonna push down and try beat your arm. So how does that feel?
And try to do what to the arm?
You're gonna try break the position without hurting yourself. So can you hold your own force up is basically what we're asking, or can you hold a 5 kilo, 10-pound weight in front of you, or your handbag? So how does that feel for stability?
Fine.
Yep. Okay. So what I want you to do is, I want you just to relax for me, Suzanne. I want you to just stand as you were. Good. Now, I just want you to relax and feel the heaviness of your chest a little bit. Okay, that's good. Now just don't let your head go. I need you to stand up a little bit taller. All right, that's not too bad. Oh, so don't go forwards. Just relax.
Okay.
There. Oh, there. Do the arm test now. So hopefully everyone can see that she's a lot straighter. How does that feel?
Good.
Same, better, or worse?
Less tension.
Yeah, that's what we want, right?
Yeah.
Okay, so for you, you probably feel like you're a little bit further forward than you normally would be. Is that about right?
No. I feel like I'm shorter.
Yeah, okay, that's fair. So if everybody watches, so has everybody, you can click on Suzanne's square in the bottom corner there. Make sure that she's the big screen. And then what I want you to do is watch when she goes from this posture to her usual posture. So go to your usual posture now. Okay, so can you see that Suzanne starts tensing up a lot of muscles? So I see lots and lots of tension through here as Suzanne tries, yeah, as she tries to pull herself up.
All up in here. I pull my whole body up.
Yeah, why do you do that?
I don't know. Maybe I was a swimmer and I was also in a swimsuit or something. But anyway, I know what you're talking about. So what I'm supposed to do is go like this. I'm supposed to not care about my stomach. Okay, really. And then just kind of let that go. And then let my shoulders go much more forward than I think should go. And bring my ribs a little in too, like this, right?
Look, you look comfortable there. It's hard to tell because everything is black. So it's hard to tell the individual components, like where your shoulder is sitting exactly, etc. But you look a lot more comfortable. Do you feel more comfortable like this, or do you feel more comfortable the other way?
I feel more comfortable like this.
Yeah. So I would say that this is a good posture for now. But I've always said that your best posture is your next posture. And what that means is that you just got to keep changing postures. Okay?
Okay. And so did you see me remarkably be able to pull my rib cage in a little bit and down?
Show me what that looks like.
Okay, so when I first started, I went like this. Okay, this is my normal posture, right?
Right.
Okay, and what I did was I collapsed.
Yeah, I saw that.
Okay, and then just let my shoulders kind of hang down a little bit more and let my stomach go.
Yeah, that's not necessarily what I want, but at this stage, it's a transition into what I want. So, ideally, would have to keep working towards getting it right. But that's okay.
So what would you ideally want?
Ideally, I'd want your thorax to be sitting over your pelvis and not have to pull your rib cage down and in. It should just be, it should just sit. All right, so it doesn't seem like we can get Linda on the microphone. So she's already messaged saying that she's just going to listen, and that's cool. No problems with that. That's why she's cheering. Okay, so just to bring Linda really quickly up to date, what we're looking at is posture. We've just looked at Kelly's posture. We've looked at Suzanne's posture, and we've looked at Christy's posture. I'm just going to cover some breathing really quickly now before we go to balancing the muscles, centering the femoral head into sit to stand and walking. So nodding is good. I can see the nodding, Linda, or you can do the thumbs up into the screen. That's good too. All right. Awesome. All right, Suzanne, you like breathing? I'm going to get you to breathe. So I just want you to lie down on the floor for us, if you don't mind.
Okay.
Just along that edge of the carpet's fine. Just where you were standing. Yeah, you're too far away. Right close to the edge, near that mat and the strip. It looks like tiles or floorboards or something.
Yeah, it's just kind of hold on a second. This is a anti-fatigue mat that I use for paint. But I have this little thing.
Yeah. You just need to take it. You need to take it back towards your sofa, just a little bit, like a foot, because we can't see it because of the table. A little bit more, please. Yeah, there you go. Okay, onto your back for me if you don't mind, thanks. Awesome. Okay. Again, because you're in all black, it can be hard to see. However, I think we're going to go okay. So use your left hand right on your breastbone for me, please. Yep, that's good. And then I want you to use your right hand on like your belly button. So it shouldn't be on anything hard. Awesome. Okay, we're just going to watch you breathe for a little while, okay? So
Is there a way to move the little pictures or to move her picture, Suzanne's picture up?
Yes, click.
Yes, sure.
You got to click on Suzanne in the little picture and she'll become the big picture.
Oh, she is the big picture, but the little pictures are covering what she's doing, so I can't see.
Oh. Turn, are you on a laptop or what are you on?
iPad.
Oh, iPad? Okay.
I have the same issue.
Oh, okay. Can you lower the iPad, Suzanne, please? Sorry. Maybe
That's okay.
if we could just get you on if we can get you on the center of the screen, that'll be better.
Okay.
So maybe if
Hold
you
on.
bring the whole thing down onto the seat, perhaps.
Okay. Oh. I know. Okay. Here we go. How's that?
Yeah, it's still you gotta tilt it a little bit lower. If you can see the blue mat, if you can get the blue mat in the center of the screen, that'll be the best instead of the ceiling or the coffee table.
Ceiling.
Well, you know, the coffee table at the moment is where I want your blue mat to be on the screen.
Oh, that was good.
That was good, right? Right there.
Girls, what do you think? Is that better?
It's better. Yeah, it's better. I can see her.
So that's good. Thumbs up.
Oh, if I hold it that way, it's better.
Yeah, so turning your thing is good. Suzanne, you're gonna have to turn your mat. If your mat is currently 12 o'clock and your head is the 12, I need it at about 1 o'clock because you're on an angle to the camera.
Got it.
Thank you. Oh, Linda's just messaged again. Let's see what Linda's saying.
Better.
Much better. Okay, wriggle down just a fraction. There you go. Hand on your heart, hand on your belly. Yeah, sorry, still can't hear you, Linda. All right, just breathing. Now, I'm sorry to ask this question, Suzanne. Is the hand on your chest on the bone or is it on soft tissue?
Soft tissue.
Yeah, I need it to be on the bone if you don't mind. So, yeah, that looks better.
Right.
Yeah.
Right.
That's better. Okay. So, can you tell me what you're thinking about when you're breathing, please, Suzanne?
I'm thinking about where it's coming from.
Okay, you got to tell me what that is, though.
And that it seems to come a lot from my belly.
Uh-huh. Is that
And some of it comes from up top, but some of it comes from my belly too.
right? Is that deliberate?
Well, yeah, I think I trained myself at one point to do belly breathing, and then later on when I went to PT, the guy said, no, you should do mutual diaphragm and belly, and share the wealth.
Right. That's good. That's what I say too. So
Yeah.
so just keep breathing for me. And what I want everybody to see is that you do a lot of movement from your tummy. And you're trying to even it out with your chest, which is good. I want to see the evening out. That's much better. Can you feel that change?
Yeah.
Yeah, so even just talking about it, the fact that we can change it by talking about it means that it's a coordination problem. Okay? If it is a problem, it's going to be a coordination problem. All right, very good.
Okay.
Now,
We done?
no. So what I want people to understand is hands back where they belong. Thanks, Suzanne. So on the chest and on the belly. So what I want is as you breathe in, whether it's through your nose or through your mouth, I don't really care, to be honest. Your chest should rise as much as your belly should rise. That's when you breathe in. When you breathe out, your chest should fall as much as your belly should fall. Okay? Now, also with that, as you breathe in, your pelvic floor should relax. And as you breathe out, your pelvic floor will reflexively tighten just a little bit. And we know this from the studies that were done, which looked at coordination of breathing and the pelvic floor contraction. Okay, so you can use breathing out to help trigger a better core contraction, being the pelvic floor, transversus abdominis, lumbar multifidus, and diaphragm. So breathing out will trigger the other three better. Well, at least the pelvic floor anyway.
Okay, say that. Okay. Okay, so inhaling, the pelvic floor goes down.
No, in the inhale, the pelvic floor relaxes.
Right. Relaxes or goes kind of down, right? And then moves away from the diaphragm. And the increased pressure. There's increased pressure in between the diaphragm and the pelvic floor, right?
Yeah, so we're heading off into the technicality, which is technically right, but the problem with the technicalities are that what technically happens and what you feel may not be the same thing, and I'd prefer to stick to what you feel. And if you search for the feeling of your pelvic floor going down, you can be producing too much of that downward force. I'd rather you just thought about breathing in, relax your pelvic floor, breathing out, tense it up.
Okay.
Good. Good. That looked like a good cycle to me. How are you feeling?
Good. And this is similar to the pelvic floor exercises that I do with whenever I do my pelvic PT. She always has me breathe in first, and then contract the pelvic floor.
On the breathing out?
On the breathing out, yeah.
Yeah, and the reason why we do that is because that's consistent with what the research tells us is a nice way to use the natural efficiencies of the body. So we're just trying to work with the body. You know, all good women's health PTs will teach that for sure. And you know, musculoskeletal and sports as well, ideally. That's all consistent with the research, and that's good. So I just wanted to point that out because we were talking about breathing. Now, if you can stand up for me, please, Suzanne, and we can do that.
Do what?
We're going to do 2 tests. So you're going to have to move that computer back, I'm afraid.
Oh.
Sorry. Yep. Okay, so can you see that that's very military? That's her old way. So
Oh, that's my old way.
yeah, but I'm okay with your old way. Let's just do the test with your old way. I want you to do the
No,
old.
I'm gonna do the new one.
Well, we got to do a retest on both to see which one's better for you.
Okay.
So do your old way. It is very military.
Okay.
Now, what I want you to do is to do your pelvic floor contraction and then do the arm test for me, okay?
Okay.
Yep.
So do the breathing.
So breathe in, breathe out, pelvic floor, arm test. This is your old posture by the look of it, which is good. So get that pelvic floor contraction and then resist the right arm again, the same way you did before. How does that feel?
Okay, but okay.
Okay, good. Just remember what that feels like. Now what I want you to do is the new posture. So nice and relaxed. You can put your hand on your heart and you can put your hand on the belly. That's good there, Suzanne. That's good. So breathe in, breathe out and contract. Lift up that arm. Resist that feeling. You're there. So breathe in, breathe out. Contract and hold. Lift the arm up and hold position. How does that feel?
A lot less tension.
Perfect. And you can use weights, so you can use like a gallon of milk, for example, or, you know, a gallon bottle which has water in it, and use that as a weight to hold up in front of you, if that's a weight that you can manage, of course. But you can see the ease of lifting up something out in front of you. You can, there's a whole bunch of different muscle tests that you can use. So that's breathing and coordinating your breathing, which is your diaphragm. We were talking about your diaphragm in the group before. So coordinating your diaphragm with your pelvic floor and giving you something to lift up. There you go. There's a weight. That looks like it's about 2 pounds or 3 pounds. Is that right?
5.
5 pounds, 2.5 kilos. Okay.
5 pounds.
Yeah, that's good. Lift it up.
5 pounds.
So lift it up in front. How did that feel to lift?
Tension.
Okay, do the new way. How did it feel?
Less tension.
Okay, that's good.
Less tension.
That's what we want. We want less tension. Same weight.
What's really weird about this, cognitively, is that when I do the second posture, I feel like, because I'm kind of just letting it all hang out and everything, the force of the front of me is pulling on the back of my spine, theoretically.
Well, it's because
You
you're
understand what I'm saying?
I'm not sure, so I'm going to try translate. So when you lift the weight up in front, you can feel the effort in the back muscles. Is that what you're telling me?
When in the old way, when I go like this,
Yeah.
okay, reason, because of my stance, because it's the soldier thing, because I've braced myself.
Yeah.
That's a key word.
Yeah, there's a key belief there.
Okay, because I've braced myself, then I feel like that bracing, the muscles are all ready to go ahead and accept that weight being up.
Sure.
So all the muscles have been called into action everywhere to do this. When in fact, they should not be all called into action. But the only muscles that should be called into action are these muscles. are these muscles?
No, no.
And maybe some of
All of
maybe
them, all of them will need to be called into action for sure. It's just that when people think about these muscles, they call more than they need to into action, and that it comes at a cost. It's a cost of compression. So,
okay.
so that's why people feel
now-
achy.
So now when I just relax and then just try to isolate what muscle I'm trying to use.
Yeah, no, you see, I thought you were thinking about it a little bit too much. You need to just,
Oh, okay.
you need to just not think about it and just do it. So if you just follow exactly my instructions, I'll walk you through it again. So just face through to the right, to the left, that's it. So breathe in.
Okay.
So I want you to breathe in, breathe out, and do the really gentle contraction. Breathe in, breathe out, do that gentle contraction and lift the arm. That's all you have to think about, contract and lift. There you go. That looked good to me. How did it feel to you?
Good.
Awesome. Linda says, stops thinking, Suzanne.
Yeah, you're one to say it, Linda. She's a woman after my heart.
I just have to read out the messages from Linda as she posts them on Facebook. All right. So we're doing well.
Okay.
We're doing well. So are you guys good with all of that? So that's posture, breathing, coordination, and all of that leads into what we're doing.
Right.
All right. Now we're going to coordinate now the muscle balance type of thing. So all of you can do this if you want. You don't have to. You can stay and watch, or you can do it where you are. But basically, you can do it in sitting or standing. I just want you to, I think we did this last week, Christy, about the abs and the back muscles.
Yeah.
So put your fingers into your tummy, put your fingers into your back, one hand for each. And you can do this too, Linda. We can see you. So put your fingers into your tummy, put your fingers into your back. You can be sitting or you can be standing. And I want you to lean forwards and tell me what happens to your tummy. So your tummy, and then your back. So when you bend over, your tummy should go softer and your back should go harder because your back muscles should be working.
What part of the tummy muscles?
Anywhere in your belly.
Okay, and where in the back?
Anywhere on your back that's not a bone.
You mean on like the multifidi? Feel that?
Technically you can't feel multifidi because they're stuck under the erector spinae. But yeah, in that area is fine.
Okay.
Okay.
So just do like.
Yep, so
Okay.
that's fine. If you take one step forward, Suzanne, that'll help. Linda, I know you can't hear us, but you're doing the right thing. Just put one hand in your belly for me, if you don't mind, so that you can feel what the tummy muscles are doing at the same time as your belly. Oh, sorry, that your back is doing. That's good. Kelly, you seem to be doing well. So just bend over and then poke your tummy muscles. And they should have gone. You're bending a little bit too far. You don't have to move very far at all. Just move a few inches, and you should feel that your tummy muscle goes softer, and your back muscles go a bit harder.
Yeah, that happens to me.
Yep, that's good. That's a good reaction.
I try to feel it in my stomach. I feel it in my back. I feel a big difference in my back turning on and off, but my stomach, I'm trying to find the right spot, I guess.
Look, right next to your belly button's a good place to go.
Okay. On top or?
No, not in the
side?
belly button, just to the side of it. Just to the side.
Okay.
Linda, don't sit down. I'm coming to you.
Okay. I think I have a good neutral spot.
Okay, so you can feel the back, and then the stomach you can't feel so easily. Is that right?
Yep.
Okay. All right. I don't know what March Madness is, Linda, but that's cool.
Basketball.
Oh, basketball. Okay, cool. I'm sorry. All right, Linda. So you do a little bend forward for me, please. Awesome. Okay. Do you feel the back hardening and the tummy softening? Thumbs up or down? Okay, good. Nice, nice, nice. Awesome. All right, Kelly. So your tummy, you can have a seat now, Linda. That's good. Unless you want to keep practicing, I'm never going to stop people practicing. Kelly, did you feel the tummy go softer or did it stay roughly the same?
Let's see. Yes, it goes softer if I tilt forward.
Yeah, good. That's a normal reaction. Okay, when you go backwards now, and you don't have to go very far, the opposite should occur. Okay, so tummy should go harder, back should go softer. And you can practice, Linda, that's cool. You can do it in sitting or standing. And it's
a little bit, yeah.
Yeah? See, if you try lean back any further, you'll feel that your tummy muscle will pull even harder with your leg muscles.
Yeah.
Cool? Yeah, I think that's pretty cool.
All right. What are you giggling about, Christy?
I like Suzanne.
Are you feeling that, Linda? Are you feeling that, Linda? Linda, we're waiting for Linda. Thumbs up. Or she's typing a message by the look of it. Here we go. Oh, could I repeat? Yeah, okay, no problems. So yeah, leaning back like that. So hand on the tummy, hand on your back, lean backwards. The back should go softer. The tummy muscles should go harder. Okay, she's going to type a reply for us. Are you on a laptop, Linda? Yeah, you are, because there is a chat. There is a chat function. If you go to the left, there's a chat function, and you can directly chat into the screen. It does have your full name on there, Kelly, but it doesn't. I won't print it. It's just in the video. Is that okay?
I was just gonna look on my laptop and see if maybe I can see what she's looking at.
Kelly?
Yeah. Are you
okay if your name shows up in the screen? Are you okay with that?
Okay. Yeah, I don't think anybody will find the video unless they're looking for it specifically.
Okay, cool.
That's fine.
All right. So, can you see the chat there, Linda? Oh, there it is. Upper thoracic to the SRJ. On the left side or the right side? Both sides? Okay. All right, no problems. So you may find that the muscles won't turn off because they're trying to protect you. So is that what you're feeling, that your back muscles don't turn off? Yeah, okay, cool. Let's try I don't know what that means, but that's cool. Let's try do something.
You don't wait.
I am issues.
That's not.
What about the opposite?
Oh, okay. All right, cool. I am issues with my back. Yes, I have. I have issues with my back. Cool. Standing up, you just have to listen to me, so you don't have to respond with words. What I want you to do, very good. Stick your hands in your back, both hands in your back. Now, it's unfortunate that Linda missed the first part of the posture change, but what I'm going to do is just talk her through the posture again. I just want you to feel the weight of your chest, Linda, and just relax your shoulders and relax your tummy and relax your chest. Can you see, guys, how she's leaning backwards? Right? She's angling back. So what I want you to do, Linda, and I apologize for the violent illustration, but just imagine that it's March Madness, you're on the court, and somebody elbows you in the tummy just a little bit, just a little nudge. Yeah, and that's it, perfect, stay there. Now, it probably feels like that you're falling on your face a little, and to the rest of us, it looks like you're straight. Do you guys all see that?
Right.
Yeah, so she feels like she's
Yeah.
falling forwards, but she's actually straight.
Is she on her heels? Ask her if she's on her heels.
No, she's standing.
I mean, is her weight on her heels at all, or centered on where?
She's,
in her feet.
So she's saying that
In her
it's
feet.
spread. It's spread throughout the feet, I think she's saying.
Okay.
Yeah, I can't see your hand anymore, but that's cool. That looks a lot better, Linda. A lot better. So, bring that screen back up so that we can see your lovely face again. There we go. Not too high. That's a bit high. That's it. Perfect. All right. So, get back to that position. So, elbowed in the guts a little bit more. There you go. A little bit more. Bring your chest over your pelvis just a little bit more. Forwards. Sorry, not backwards. Forwards. There you go. Yes, that's much better. Okay, now just imagine you're a puppet and you're just going to go a little bit taller, only by a 32nd of an inch. Not very far. Beautiful. All right, tell me what your back feels like now. So is that
She has
tense?
to type it.
Tight? Is it tight?
She has to type it.
Oh, okay. All right, yeah, type it. I don't mind. Soft. Soft
Or
is
she-
good.
You can go like this.
Okay. All right. So soft is good. Use open hand for soft and a closed fist for tight, okay? All right. So it feels soft. Is that right? Awesome. Okay. Now, put your hand in your back. Use your left hand so that you can talk to us with your right hand. Now lean forwards. It should go hard. Is that right? Yep, it goes hard. Now go further backwards. Go further backwards. Shift your hips forwards. Push your hips right forward. There you go. What happens to your back muscles now? Soft. Soft is perfect. See? So we change that reaction, okay? I'm going to suggest to you that your upper thoracic to your SIJ tightness is related to how your posture is. Because with your posture, we just made those muscles softer, right? So we just took that thread away. So just use the weight of that chest. Put your chest over your feet a little bit more. That's it. When you see the playback of this video, you'll see what we mean by you look a lot straighter even though you feel like you're falling forwards. And that's because your brain works. Yeah, that's probably how you feel. Your brain works by taking information from your receptors all over the place. And if you go too far forwards compared to where your home is, you know, the home position of where you're used to, your brain will start screaming at you that you're too far forwards. Do not go looking for that forward feeling, because if you go looking for it, you will eventually end up too far forward. You've got to use things like your screens, take photos, use mirrors, but you want to just get back to that breastbone over the pubic bone posture that I talked about last week with Christy. Yeah. Now you just need to, you're still arching your chest up, Linda. It feels like, yeah, that's better. Don't pick your chest up so much as just let it sit and relax and just grow taller through everything. That's it. Your shoulders still look like they're a little bit tense to me.
Oh, that's good.
Yep. Tell us what you think. Tell us what you really think. Oh yeah, is that why it looks like that? So there's a bone spur in her AC joint, she's saying. Yeah.
Oh.
Well, you know what? People have bone spurs all the time and no pain.
So
So
let me ask a question. So does the bone spur prevent you from standing because it hurts?
I'm going to say that's a no. So the bone spur's compressing the nerve in your shoulder. That'll only give you arm pain, yeah?
Oh, in the shoulder. Okay.
Yeah, and then it throws tension into her neck. So the tension...
Oh, okay.
Yeah, maybe. That's just going to be protective
Does it
tension.
hurt? Does it hurt when she? Maybe.
Sorry, Suzanne, your audio is very laggy and your video is very laggy as well. I can't tell what's going on. Yeah, just keep working with it, Linda. Keep working with it.
Okay.
All right, good. How does your muscle spasm feel now? You said it's been bad the last couple of days. Is it good, bad, ugly, same? Okay, better when you stand. If you want to stand, I don't have a problem with that. That's good. All right. Let's just, we'll move on. So, I want you all, and we'll just shortcut all of this because 1 hour is up and I just want to get through the next half an hour with doing some things. Are you all good for another half an hour?
Sure.
Yep.
Yeah.
Okay, cool. All right. So what I want you to do is to stand up, and we're going to do the same thing as the tummy and the back muscles. I want you to stick your fingers in the front of your hip, in your hip flexor or your TFL, and in your glutes. That's it, Linda. That's good. Kelly, that looks good too. Suzanne, can you take one step forward for me, please? That's better. So, yep, you got that. I can't see where you're sticking your finger in your glutes, but I'm going to assume that you're doing okay there. And Christy's still moving the camera around. Yeah, Suzanne, that was you. Yep, okay, that's good there. Yeah, that's good. If you can tilt that iPad down a little bit, that'll be really helpful, Suzanne. That'll be really helpful. Thank you. Ah, that's much better. Thank you. Oh, Christy, I lost you.
So on one side.
I have 20% battery.
Oh, okay, no problem.
Okay, one side one and one side the other.
Yeah. If you're particularly, if you can reach around with your right hand to get the hip flexor, and then you can use the left hand in your glute on the same side, Suzanne.
Okay.
Okay, so hold on. Use your left hand on your left glute. Right hand on your left hip flexor. It all depends on how people's anatomy is. If you've got short arms or long arms. I think Linda's doing just fine. Kelly, you're doing just fine. Suzanne, you're doing fine. A little bit twisted. And Christy's just gone to get a charger, I suspect. Very good. Okay. Now, when you lean forwards, I just want you to lean forwards as if you're going to start sitting down. So just a 1/8 of a squat. Just a real... Yeah, that looks good, Kelly. That looks good, Linda. That looks good, Suzanne. Now, all of you should feel that your hip flexors are relaxed. Do you feel that?
No.
Okay, that was a yes from Linda. That was a no from Kelly. Is that right?
That's right.
Okay, Kelly. If your hip flexor did not go soft, you're squeezing your muscles too hard. How about you relax your back, relax your back. So sit back, but put the pressure through the center of the foot like we talked about. So see how you're onto your heels? I want the pressure in the center of your foot.
I don't know if I'm coordinated enough to do that.
Oh, you're doing well. Just lean forward onto the balls of your feet a little bit.
Okay.
Yeah, keep your chest between your feet.
Okay.
That's it. That's it. Does that go soft?
Oh.
Is that better?
Now I feel it in my back, though.
Yeah, that's okay. Don't worry about that. They're supposed to work. Right? They're supposed to work when you do this. That looks good, Linda. How do you feel?
We're supposed to work, not the back.
No, your back will have to work to hold you up. Otherwise, you'll just collapse forwards.
Okay.
So your back muscles should be working, your glutes should be working a bit, and your hip flexors should be turned off.
Yes, my hip flexors less, my glutes a little bit, and my back a little bit.
Good. Linda, how are you going? Good? You feel all of that? So the glutes work a bit more, and the hip flexors are relaxed. Awesome. Okay, Suzanne. I'm sorry, Suzanne, I can't see you. The tilt is too big.
Oh.
Sorry.
Is it okay?
Yeah, that's much better. Thank you.
Yeah,
Yeah, that works.
that's working. Yeah.
Good. Christy, how are you going? Do you want to face the other way so we can see your right hip, Christy, please? Ta. Now, if you can see what Christy's doing, if your hands are big enough, you can do the hold on both sides like Christy's doing. So you can feel the back and the front at the same time. Christy, use your thumb a little bit lower, about 3 inches lower for me, please. Yeah, that's it. That's where it needs to be, right behind that greater trochanter. That's
Behind the trochanter.
Yeah. Where you were is okay. And this is the handhold that we use, so thumb in the front and fingers at the back. That's good. That's it there. Nice. Okay. What's working, Christy?
Well, to get the hip flexors less taut, what I'm finding is more of an anterior pelvic tilt and then a little bit of forward flexion from my normal posture. So
Yep.
if I come here and then I come here,
Yep.
then it's a little quieter.
Yep. That's good.
But I really want to lock my knees out.
That's not bad. That's not bad either. Forcing your knees to lock is not good, but having your knees locked, I just want people to realize that your knees actually lock because it's an energy efficiency strategy, right? All of these people that say that your knees shouldn't be locked out, they don't understand you shouldn't be locking out your knees into extension over pressure. But having your knees locked is not a bad thing during standing, especially if you're going to stand still for a long time. Because you don't want to have to use your knee muscles, your quads and your hamstrings and your calf just to hold you up the whole time. So that's why our knees do lock out. Okay, so that looks good there. If you go with the anterior pelvic tilt and the slight forward flexion, that's not too bad at the moment, Christy. That looks a lot better than before. I still think that your chest tends to trail behind your pelvis a little bit. The angle is not quite right for me, but I'm happy with this position for you. That's good. All right, now what you can do now is... no, turning that way is not as good, Christy. No, it's not the camera. It's... Yeah, so I feel like you need to bring that right foot back towards... the right foot back more. Because you're not square to the camera. Keep coming. Okay. Now, level up your feet and face where your feet are pointing. Okay, so bring that left foot back to where you were. You need to turn to 1 o'clock. Hey, there we go. Perfect. All right. Now, girls, you can do the same exercise. And when you lean backwards, the hip flexors should turn on. And your glutes will probably go a little bit quiet to a point. Don't lean too far back. So, Christy, just start that. How does that feel, Christy?
I don't. Right about there is where I feel the front of my hips start to tighten up.
Yeah, that's good. So that's working for you.
Yeah.
Kelly, how's that feeling for you? A little bit lower with your thumb, Kelly, and your fingers. See the roundest portion of your bottom? The furthest out the back? Yeah, so it needs to go lower. Your hand needs to go lower. That's good. Now bring it around the front a little bit more. So bring your thumb right around the front.
Oh, okay.
Yep. And your thumb needs to be lower, Kelly. There you go. There you go. Perfect. That's much better. Okay, so lean backwards. The butt should relax a bit. The hip flexors should fire up more.
Yep.
Good. Okay, Linda, we're on to you. You're leaning backwards. You're feeling everything? Awesome. So is your back quiet at this time too? Soft? Good. Awesome, soft. Okay, Suzanne, how did you go? Awesome. Awesome.
All systems.
Sorry, I didn't catch that, Suzanne.
All systems go.
All systems go. Very good. Okay.
It was good.
All right, guys. So just have a break now. So that's muscle balance. And I want you to understand that your muscular balance, one component of that is simply your posture. Leaning backwards or forwards in your posture will actually cause an automatic reaction in your muscle contractions. So if you feel like you've always got to stretch your hip flexors, a lot of people will just say, well, then stretch your hip flexors, get it massaged, use a ball, get acupuncture, use gua sha, all that sort of stuff. But maybe it could be as simple as your posture is that you're leaning back too much. Even though it doesn't feel like that you're leaning back, you just might be leaning back. Okay? What I want you to do, Christy, is set up the dining room chair for me, please. We're going to do sit to stand, and then we're going to do walking. Okay? So I got Christy to get a dining room chair. If any of you want to use a dining room chair, you can bring it into the room. We can do this. I'm going to teach you how to center that femoral head and then stand up with it. You can use the ball if you want, Kelly. That's cool too.
Oh, yeah, or have a piano bench kind of thing I could use.
Cool. Yep, perfect. That's good, Linda. That's good. Suzanne, yep, that looks good to me. And, oh, yeah, you got a bench. Look at that. Can you take that 2 feet backwards for me, please, Kelly? No, backwards as in towards the door that I can see that's open. The archway. Yeah, forwards that way. The way you're facing.
This way.
Yeah. That's better. Awesome. All right. So, what I want you to do is to put your fingers where they belong again. So the front of the hip, or TFL. A lot of you complain of TFL and ITB. So stick your fingers in TFL and ITB, and then stick your other hand on your butt, or you can do the one-handed thing that Christy's good at.
Oh.
Good. Okay. Now what I want you to do is,
Okay.
I want you to lean forward. Christy, do you have enough room to stand up there?
Yes.
Okay. Just lean forward for me at the moment, Christy. So just lean forwards. Yeah, so I call that upright. So now lean forwards from upright. Awesome. Okay, so sit to stand should be starting from upright, and then you go to lean forwards, and then you come out of a chair. Now, at the moment, Christy, you should feel that your hip flexor is off, and you should feel where your middle fingers are, that it should still feel relatively full there. Is that right?
Mm-hmm.
Okay, good. I can't see your head, so you're going to have to speak up.
Oh, yes.
Yep, cool. Okay. Now, go to stand up and tell me what you feel, please.
Before I stood up, I felt the under my thumb come on a little bit, and then it went off, and then I stood up and didn't really feel anything.
Okay, so you had that automatic contraction that drew that. Well, you know, mechanically, people say that it went forwards, but you know, from a coordination, really, it's a coordination point of view. You had the hip flexor fire when it didn't really need to. So I'll just get you to move your chair away from the camera about 2 feet, 3 feet, Christy, please. Yeah, awesome. Okay, let's just do that again. And you can all try the same thing. So what should happen is that your TFL and your hip flexor should not fire because you can passively lean forward, so you don't really need them to lean forward. And then you should be able to stand up without making them work very hard at all. Off you go, Christy. And the others. How did that feel?
Good.
Good?
I didn't feel the hip flexor turn on. I think before it was from adjusting my feet.
Yeah, and that's
Yeah.
probably true.
Yeah.
So I'm on to Linda. How did that feel, Linda? You leaned backwards at the end there, so you probably felt it turn on a bit. Type us your response. Oh, you just muted Christy. And I can't see your message, by the way. You might have to hit enter. Not so much on the right, more on the left. Okay. Linda, I'll just get you to try that again and then tell me how you feel. But when you do that, when you come back, can you unmute Christy, please? Because you muted her. No, not at the top. At the bottom. On Christy, there's a drop-down box. And you got to unmute her.
I don't know how to do this.
Hey, Christy, can you try unmute yourself, please? Ta. All right. Well, while you're doing that, girls, I'll go to Kelly. Kelly, just Yep. Can you feel it? Oh, yeah, you're unmuted now, Christy. That's good. How did that feel, Kelly?
It's good. I have attention to my knee come back, and now my neck is kind of cracking.
Sorry.
So I'm not sure if from something I just did or if it's that,
So
just kind of.
can you say that again for me, please?
So now, I think the hip and the glutes were fine when I stood up, but my neck is kind of cracking and my knee is like I have the tension in my kneecap again.
Yep. Okay.
So
Can you just sit down? We'll see if we can work through it. Obviously,
okay.
I'm not your therapist, so I can't tell you exactly, but maybe we can change it. Okay, so what I want you to do is to start with your feet underneath your knees a little bit more. So bring them back a little bit for me. There you go. Good. Now put your hands inside your hip creases. Yep. Don't worry about the glutes for now. So just do both hip creases for me, please. Okay. I want you to lean forward for me. Put your chest over your feet if you can. That's it. How does that feel there?
That's good.
Okay, stand up for me and tell me how your neck and your knees feel when you do that.
That's better on my knee.
Okay, so go again. Go sit down again.
Okay.
Okay, now I'm just going to get you to do something bad, okay? Well, I shouldn't say bad. I'm just going to say that this is more likely to produce symptoms, okay? So I want you to squeeze your butt cheeks together. Tell me what happens when you squeeze your butt cheeks together.
I'm holding a pencil.
Yeah, you can hold a pencil. Very good. But it probably tenses up at the front a little bit as well. Quite often.
Oh, in my hip?
Yeah.
Yeah.
Okay, stand up with your butt tensed a bit.
Okay. Isn't that what we're supposed to do?
No. How did it feel?
A little too much.
How did it feel?
It felt like it was a little too much, like, felt a little unnatural.
How was the knee and the neck?
The knee a little bit more tense, the neck not.
Okay.
No issue.
All right. When we stand up from sitting down, you shouldn't have to think about using your bum. Your body will use the bum. Okay? It will use those glute muscles. So sit down the way that I showed you. So fold from the front. That's it. Good. All I need you to do is start upright, lean forwards, stand up. How did that feel?
Good.
Okay, no more tension in the knee or the neck.
Actually my neck a little bit.
Okay, well then do it again and make sure that you keep your alignment, okay? Keep your head up.
Okay.
Good. Feet underneath. That's it. And come up. How did that feel?
Better.
Okay. Good. Linda, how are you going? It's okay? Do you feel your hip flexors turning on at all? Slightly? Okay, redo that again. Try again. Now, oh, not yet. Okay. So, guys, I want you to see that she's in a posterior pelvic tilt, okay? It's going to turn her hip flexors on. So, Linda, I need you... You're in a posterior tilt partly because your chair tilts backwards. So, on your sitting bones, I need you to sit on the front part of your sitting bones for me. So, sort of do a little bunny hop up and sit... Yeah, more like that. That's better. All right. Now, lean forwards from the hip creases. Keep your chest up, head up, lean forwards. Good. Now come up. What happened there? It was okay or just a little bit? Just a little bit. Just a tiny bit. Okay. So sit down again. All right, go further into the chair because you're going to feel more secure. That's it. Bring your feet underneath your knees a bit more. They look a little bit too far out. Yeah, that looks better. Now, bring your chest over your knees. You can open your knees up a little bit more unladylike. Stick your butt right out and chest up. That's better. And now come up.
Oh, that's better.
How did that feel? Yeah, there you go. Good. All right. Nice. Yeah. All right. So you got to work on your pelvic tilt. Too much pelvic tilt on the back. It's hard to tell, Linda, but yeah, you see you got a lot of long flexion going on. There's lots of things to work on there. But look, you know, you're looking still good anyway. All right. Be thankful that you're not my patients because I'd be using the whip on you guys. All right, Suzanne, let's have a look.
That never stopped you.
Yeah, I know, but hey, this is being recorded. Come on. All right, let's have a look. Up you come.
Okay, so
Yeah, stand up. Let's have a look. Right. I think, Sue, right at the... Are you Sue or Suzanne?
Suzanne.
Suzanne, what it looks like it happens is...
Suzanne.
Yep. What looks like it happens is that right at the very end, you extend your hips too far, and that's when you're going to feel your TFL and your hip flexors turn on. So stand up. So just stand up, yep. Yeah, so right there, right at the very end, if you feel it turn on, that's what I think might be happening there. How did they feel?
Okay, hold on.
How did they feel in the TFL and the hip flexor?
Hold on.
That looked better to me.
Yeah, that was better.
Yeah, that looked better. Okay. So do you understand what I'm trying to get at here? Like when you guys move properly, your muscles will do what they're supposed to do. If you have an aberrant movement pattern or a posture that isn't quite right, you'll start using muscles which you don't want to use. And that's why I keep talking about, like, you all like talking about what the muscles do and what muscles are on and what muscles shouldn't be on and what muscles should be firing when. But ultimately, I want it to come down to movement patterns and thinking about movement, not thinking about what muscles should be doing what. Because when you start thinking about the muscles, it interferes with what the brain is doing. So let's just do a really simple test that I do quite often. All of you are sitting there in front of the screen right now. I just want you to touch your nose. Just touch your nose. Awesome. How many of you thought about every single muscle that you needed to do to get your finger to your nose, right? None of you look like it because you all just touched your nose. And in the same way, standing up from a chair should be as automatic as that. Do you remember how you were thinking about your posture before you did the arm test, Suzanne? All of that work there, like there's a lot of thinking going on, and that's very, very early rehab stage. And that has served you really well in the past, but it needs to progress on if you're to progress, because you can't walk around thinking about this stuff. You got other things to think about.
I know. So in order for us not to think about it, we need to change the patterns, and in order to change the patterns, we need to know what the motor control is supposed to do, right?
Well, what the pattern should look like, yeah. And the thing is that I heard you.
So we do. I'm sorry. Let me interrupt. So we do need to. I mean, the way I understand control and the way it's supposed to happen naturally is that in order to develop new patterns, because old patterns exist, so we need them with new patterns, which include a circle of control that's new brain wiring to our muscles, okay? So for instance, I remember that you told me when I used to go from sitting to standing, you saw that I didn't move forward at all and use my quads or anything. I just standing, I was like using the energy of my whole body to jump up and everything. And so now, I know to bend forward and do certain things, okay? But I did that several times to develop a new pattern. And so what I'm asking you is, in order for it to become unconscious and just do it, don't you have to replace the old motor pattern with a new one through doing it right for a few times and knowing what that is?
100%. Yes, you do. I just don't think that you need to go into the level of detail that I find lots of my patients want to go into. Like, my patients want me to tell them which muscle is doing what when. And the bottom line is that I can't tell you. We can tell you roughly what's supposed to happen. But, in everything in life except moral matters, I'm a hedonist. And that is, if you go with what feels good, then you're probably going to be on a better track than if you keep plugging away at something that makes you feel bad, right? So to relearn the new pattern without having pain, that's the easiest way that the brain will latch onto that and go, wow, that didn't hurt. Let's do that again. And if you can get that going lots and lots of times, I will guarantee it that it will stick unconsciously so much faster than if you do something that takes a lot of thought, a lot of steps, and has a lot of tension and doesn't really make you feel that much different. Okay, so that's why I spent a lot of time getting Linda to get her back to settle down. And that's why I spent time with Kelly making sure that she felt the right pattern, because if you feel what feels good and it feels right, then you're much more likely to be able to transfer that feeling into all the other different exercises that you want to do. Because you can go, you know what? It's possible when I do this. It's possible when I do something else. How do I do it? I don't need to be a PT to figure out how to move so it feels good. PT just shortcuts the process. You know, I've got 2 decades of education behind me, over 2 decades, and it's not even that education that tells me how to fix you. It just gives me an understanding of the body so that I can shortcut what I need to figure out how to fix you. That's all it is. PT
Yeah,
is just a shortcut.
But yeah, I know. But Anthony, you do not know the power of your words in terms of changing behavior and patterns, because I filmed myself from sitting to standing once at my art studio, and I was like giving me feedback on it. It's probably still on the site. And you said, Suzanne, you're not capability of everything that you can. You need to be leaning forward and go. And I was using my quads totally, and I was using the force of my feet going back and forth like this and jumping up and you know.
I remember.
And that analysis alone has changed my life in terms of sitting up.
Sure, and
So
and
so it would be neat if we could get like examples of the perfect way to do it.
oh well, you see, here's the thing: there is no perfect way. It's the hedonism. It's the feeling good way. It's just got to feel good. It only has to feel better. There is no one perfect way. Let me assure you.
But okay, if you had that the rest of my life without figuring that out.
Yeah, I
So
agree.
how does the hedonism figure out? Oh, La La Land, I'm gonna figure it out one day.
See you, Linda. Thank you. We'll catch up soon, Linda. Yep. Okay. Fair
Good
enough.
night.
Good night. Sorry, Linda had to go. She's just sent a message. Look, with the feeling good thing, Suzanne, I just want you to know that it's possible, and then I want you to play safely and with your therapist into finding ways that are not painful, that are less stressful, that are less tension. And yes, a lot of my experience will shortcut that process. And you're right. Like, I'm not saying that PT is no good. Obviously, I'm going to say that PT is very good. But I want you to not become reliant on PT and actually realize that you can do a lot of this stuff at home. And the reason why I know is because I get patients that turn up and they go, well, when I did this, it hurt, and then I did that, and then it didn't hurt. And that is the launching pad for our session that day, where we explore what exactly did they do. I take that principle, break it down, and then apply it to things that they couldn't do it in. Do you see what I mean? So it's not actually me deciding what worked. It's the patient telling me what worked, and then I help guide them into applying it to other areas. So there is no one way to get up off a chair. Look, if you, Christy, can you do a butt shoot stand up from your chair for me, please? So I want you to we call a butt shoot a butt shoot. It's when you lean right forwards and then stand your legs up straight and then stand your body up straight. So watch Christy here just for a second. So really bad pattern. That's a butt shoot, okay? Now there are some people that'll get really upset if Christy had done a butt shoot when she stood up. But like I said, if it gets you up out of pain, so do that again. And this should not hurt, Christy. I hope it doesn't hurt you. Right? That's not the perfect pattern. But it's not particularly dangerous. You know what I mean? And if it gets her out of pain, and if it gets her out of the chair without pain, I have no problem with it. But it certainly doesn't look pretty, does it?
No.
Okay? But I'm not going to get mad at Christy.
Christy, show us what you think the best pattern is for you. For you.
All right? That's a very quad dominant pattern.
Yeah.
And sitting down, that was quad dominant too. All right?
Okay, do it again. Do it again. Okay.
And the reason why it's quad dominant is because her body stays roughly behind the center of the base of support. So that means that she needs lots of her quads to help hold her up. Okay, so stand up again, Christy.
Right, and then you.
Right,
Okay.
so most of her body was behind her feet. Right, and when she sits down, most of her body is behind her heels. Right, so that loads up all the front muscles. That loads up her quads and her shins. Now, Christy,
Right.
lean, get your chest over your feet and stand up. Right, so that puts the weight more in the center. She's going to use more of her muscles. Sit down the same way, Christy.
Right.
That's better. Okay, so it's a subtle difference, but it changes the muscles that work.
It's a huge difference. Huge. It changed my life.
Well, I'm glad that it changed your life.
FY.
I'm glad that it changed your life. That's why we're doing
I had
these
overworked quad.
Yeah, that's right. Because, you know, everybody's trying to do the right thing. And I just want to acknowledge that. It's not from lack of trying. It's just, this is why I have this idea that if I tell you to just search for what feels good, that you're going to become more self-reliant, self-sufficient on helping yourself get better just by searching for the things that feel better.
Yeah, but let me give you some feedback about that teaching that you're using about what feels better and everything, because, you know, my little sergeant body that I have, you know,
Yeah.
wants to be erect and do everything like this. Okay, watch. Okay, so my body wants to go. Okay, I'm gonna be strong and I'm gonna go. Okay, I'm gonna use all my quads. Whoa, you know, like that.
Yeah.
And I never knew that I could go. I thought that was going to be a weak thing to do.
But isn't it easier?
That was a weak.
Isn't that easier? Isn't that less effort?
But I didn't. But I thought that it was putting more tension on my back, was bending forward.
Nah, I don't think so. I think getting dressed would put more tension on your back.
In my brain, my brain didn't register that would be easier, because going forward meant you're putting your back is taking all that weight.
Yeah.
I thought my lower back would take too much weight, so whenever I would stand up, I would remain erect and just use my legs, okay, and use the erector spinae, if you will, okay.
Sure.
I didn't know that I could lean forward and release some of the load using other muscles.
Yeah, and that's why we're doing these sessions. I just want to share the concept that you can change things just by moving differently.
Okay.
Cool. Kelly, have you got any questions so far?
Well, I'm just trying to think about what I should think about and not overthink about. So in standing, I should first think about centering my weight on my foot, right, where the shoelaces would be.
The shoelace knot.
And then
Yep.
the shoelace knot, and then sort of think about not being so uptight in my upper body and just kind of lean back a bit.
Yeah, so keep the pressure, so not lean back, just keep the pressure through the center of the foot, because you like to have the pressure in the front of the foot, and you want your chest over your pelvis, because you tend to put your chest behind.
Okay. My chest was too far back?
I think so.
Okay.
We've got it on the recording. I've forgotten already. I'm sorry.
Yeah. I thought you had me kind of lean back a little bit more, or sort of.
Well, I had to bring your chest forward and then bring all of it back.
Okay.
In my head, that's what I was thinking.
Yeah.
Yeah. So just stand up again. We'll just have a real quick look.
Sure.
Yep. So there you are. So yes.
Am I good?
No, you're good. You're good as you are.
Okay. Okay.
So if you stand as you normally would, so see, I see hip flexion, broken knee position. So flexion in the knee, flexion in the hips, and the chest is, look, it looks like it's over the pelvis, but everything is a bit funny. Can you turn to 11 o'clock a little bit for me, please? Your feet as well, Kelly.
My feet?
Yeah, that's better. That's better. Oh, no, hold on. Go back.
Go back. Okay.
Yeah, there's good. Yep. So I just had this idea that you're hyperextending just a little bit through here and then through here. So you can't tell. It's going to be on the recording. I just want you to relax and stand taller, okay? And now relax. That's it. Is the weight through the center of your foot?
No, it's
There's a lot of energy in her knees, isn't there?
Well, it's just because they're bent.
yeah. Well, should they not be bent?
No, they should be straight. You're standing up.
Yeah. Okay, so over the center, and then
Just relax.
um,
Just relax.
relax. Okay.
Yeah. Look, I think that's better than where you were. You look very uptight.
Yeah.
Ah,
That's a very right.
you do. I'm sorry.
Now wait,
Maybe that's-
wait. So turn around. I want to see how her front on looks. Could you go back to your mat and go back to your mat near the couch and stand facing us?
Sure.
You don't even have to go back that far.
Okay. No, go back. Go back.
Go back?
Go back. Go back. Go back.
Oh, okay, because of the pictures in the iPad. Okay.
Okay, I just wanted to see how her feet were stacked under her shoulders and her knees.
Are you happy with that?
Me?
Who, me?
Suzanne, yeah, you.
I would think that her feet might be a little bit too wide.
Yeah, I'm okay with it. It's within normal limits.
Yeah. Okay.
Yeah.
But in terms of her knees,
What about them?
My right knee is where I'm feeling it.
What do you feel?
I don't know. The knees seem to be on the thighs. Seem to be a little bit like that.
Yep,
A little bit.
I agree.
What is that? What is that called?
Well, it's
Okay.
Like
valgus.
they're kinking it.
Yeah, the genu valgus. She could be built that way. It's very difficult for me to tell from here.
Okay.
I would prefer to be a lot closer, like 3 feet away to be able to tell that, instead of
You want me
half a world away. No, I'm just saying that I would prefer to assess you in person.
to be? Yeah.
Yeah. Look, there's lots of things that we could work on. The last thing that I wanted to work on is stepping with control for the hip. So I might just go to that now real quick. Christy, we'll use you for this one, Christy.
Okay.
So do you want to set up your camera so that you can?
Do I need a hallway?
No, we're gonna do just one step forward type work. I'm just gonna show you a progression, and I'm doing it with Christy because we did the work last week on keeping that femoral head centered. So it's just gonna be quicker. All right, Christabel. Beautiful. Okay. Do you want to just take, so turn to your left and take one step back towards the lovely red curtains, please. Yeah. Okay, cool. All right. So centering the femoral head is something that we like to do. Okay, so the whole idea is that the femur bone should go up and into the back of the socket. Okay, and I'm using my cursor to speak now, so hopefully that gets recorded. Christy, I want you to set yourself up. You look like you're pushing your hips forward again. So just set yourself up, get into that neutral pelvis and neutral muscle activation. Can you kind of turn to your 11 o'clock for me, please, Christy? Thank you. How do you feel?
I feel okay.
Feel okay? Okay. Can you just take one step back because it's just going to be easier for us to see what happens, please?
Her feet didn't move with her hips. It didn't.
Yeah, it's going to be okay. Just step backwards towards the curtains, Christy, please. Keep going, keep going. Okay, good. All right. So what I want you to do is you're going to pick up that right foot. So just pick up that right foot. Now your hip flexors are supposed to turn on. This is hip flexion, okay? So it's okay for hip flexors to turn on. What I want is right where your fingers are in your butt, I want that to still stay filled out. You know what I mean by that, Christy?
Yeah.
Okay. You do that for me, thanks. How does that feel? Just pick your knee up. Just pick your knee up. How does that feel?
Both are working. I feel in the front and under my fingertips.
Good. I'm good with that. Land with your heel. Where's the pressure? In the front or the back where your fingers are?
Here.
That's where it should be. That's good. Keep the pressure there. And bring the left knee up for me. How did that feel?
Definitely a lot going on in the front. That's where I feel the most muscle activity, on my right side in the front.
Right. Now that's because you're kind of leaning back a little, okay? So take that left foot back for me. Okay. So as you come through and transfer your weight, the pressure in the back of that hip where your fingers are right now on that right side, that's good. What I want you to do is to bring your whole body as a unit over that right foot as you lift up your left knee, okay? Good. How does that feel?
It felt like less.
Yep.
Less on over here.
So the pattern's good. What happens is that when you swing through, you start to extend from your hip, and that's going to turn on that right hip flexor too much, okay? So bring it forwards. Keep your chest over your foot. That's better. Yes. Now put your heel down.
I agree.
Do you feel the difference?
Yeah.
So your natural pattern is to hinge by going into hip extension to get swing phase through on the left. Does that make... Yes.
Oh, yeah.
You see that?
Yeah.
Okay, keep your chest over your foot. Keep your chest over your foot. That's better. There's still a little bit in there, but that's what I want you to work on, okay?
Yeah.
All right, and then you can do variations of exercises from there. You can concentrate on that swing through phase as your exercise. So I would break it down even slower for you because I still saw the wobble in there. So put that right foot forward for me, thanks. Good. This is your starting position, okay?
Okay.
All right. Now, when you're ready, take your weight forward and lift up that left leg and bring it out and heel strike on the left, but keep your body in alignment, okay? Do not hip extend. Good. Good. Now, just for the record, Christy is hip extending, but my words are producing the movement that I want. So even though I said don't hip extend, for Christy, when she thinks hip extension, she actually leans backwards with her body, and we don't want that. So I'm not saying you shouldn't hip extend when you walk. I'm just using words to achieve the motion that I want to see with Christy, okay? So again, Christy, that looked much better. Yes. How did that feel?
It, I can tell the difference between when I do my walk with the extra hip extension and what you're talking about. It feels different up in the front.
Yeah. And
Can I make an observation?
sure.
Christy, could you go back and do what you were doing, but take a shorter step in your gait?
Do you want me to do the little
like when,
couple step throughs?
Like when you put your right leg out forward and then you follow with your left. When you follow with your left leg, can you take a shorter step and then follow with your right leg again and see if you can do steps and see how that feels?
Take little steps.
Doing this.
Yeah, she just wants shorter stride length.
Yes, shorter stride.
Do you want to see my normal walk, or do you want me to think about it?
Well, I really want you to think about the shorter stride. See what happens.
Okay. Do you want me to feel my muscles and tell you what happens?
Yeah, but I want you to try to. I want you to put your hands around your hip flexors and try to keep your pelvis even. Try to keep your pelvis even, and just take shorter steps and see what you feel.
Do you want more?
Yeah. Yes. Do you feel anything different?
I'm not using as much extension in general, I think.
I am married 6'4", okay? And I try to follow him with the dog, and I can't do it. And he takes really long strides. You know, I'm 5'5".
Yeah.
And I found that I was trying to stride too far, and I was using a lot more hip flex. Adult, I think I found that I was using my calves even, which was weird, more than they should do. And but that was just kind of a. I don't think your strides are abnormally long by any means or anything, but I just wanted to see how you felt, because I know that when I consciously shortened my strides, it helped me. Like when I didn't have to keep up with my 6'4" long-legged husband, it helped me.
I think I should be able to control the tension at the front of my hip even with big strides.
Okay.
So I walk a ton all day long. Walk.
Yeah.
And I walk fast, and I have big strides. So.
Yeah. How tall are you?
5'6".
Oh, okay. So you should, easily be able to have a big stride then.
Yeah. It's interesting.
So what did you think Christy's walking look like when she took shorter steps? Did it look normal?
Not really. It looked like she was taking shorter steps, but it looked like her hip flexion was less.
Yeah, so
So,
yeah, and I agree. The shorter steps, that does work to a certain degree, but the problem with shorter steps is that ultimately it's not normal. Um, and it looks like she's going to end up like an old woman who's shuffling.
oh, well, could there be like a happy medium where she learned to generate movement that's just as accelerated as move without using as much hip flexion? There's like maybe a happy medium in between the two.
So I think what Christy said, which is she should be able to control that amount of stride length at that speed is the goal. Like
Okay.
I don't think like I mean the shorter step length is an avoidance strategy for me. So it's avoiding
Oh, okay.
pain, which I don't have a problem with. But it's a regression, and if I can have Christy control it with a longer stride length, a more normal looking, like see, she just walked back with a short stride length, and that looked funny. Like do you see
Okay.
what I mean? Like
Yeah, that's too short. Yeah, that's way too short. That's way too short.
Yeah.
But what I'm saying is, okay, me at 5'5", I should not attempt to keep up with my 6'4".
you see, you can keep up with
And a long
you can keep up with your husband who's 6'4". What you'll change is your cadence, not your stride length, right? So your cadence is the number of times you turn over in a minute. And his cadence might be 1 step per second or less, and yours would be like 80 steps per minute. Do you know what I mean? So your cadence, your turnover will be faster.
Yeah, but
So that's just energy.
right, that's not fair.
Well, you know, when you fall over, you don't have as far to fall. So that's not fair for me either. I'm 6'2". So, you know. So Christy, I want you to
Yeah.
continue to work on keeping your body over your base of support as opposed to pivoting into extension and firing up those hip flexors. So, you know, when we did that exercise and you poked your fingers in the front and then we leaned backwards and you felt those muscles turn on, that's essentially
Yep.
what you're doing on one leg every time you walk. Does that make sense?
Yep.
So you do that, and then the muscles will tell you, because when your hip starts doing things that it doesn't like, the muscles will fire up to try and keep everything centered.
Yep.
All right. It's been 1 hour and 58 minutes since we started recording, girls. How do you feel?
Oh, wow.
Okay.
Yeah?
Like it's been 2 hours. Mm-hmm.
Yes, it's been 2 hours. You're all very good sports. I really appreciate your time. I'll get this video processed,
Okay, your turn.
and hopefully, look, if it just helps one person, it's been worthwhile, you know. So hopefully we've helped 4 people in some way today.
Well, really appreciate your time too, Anthony. Thank you so much.
Oh, that's okay. Thank you for stopping your painting and joining us.
Well, tomorrow's another day.
Beautiful, beautiful.
It's almost midnight here, so I think I'll paint till
Yeah.
2.
Oh, okay. You guys are nuts. And Kelly, I don't know which city you're in. Where are you from?
Minneapolis, Minnesota.
Right. Okay. Is that the Midwest?
It is in the Midwest.
Cool.
Hmm.
Well, you guys have got Timberwolves apparently there, so that's all I know.
Yes, we do.
All right, very good. Did you girls have any questions before I finished?
Yes. When are you going to schedule the next one?
Oh, I don't know.
That's just a joke. That's just a joke. You don't have to commit.
Yeah, I don't know. I definitely can't do it next weekend. I'm working in a different city next weekend, so I'll be very, very busy next weekend. But Look, I'm happy to do them when I've got the free time and you know.
Yeah, that's good. Whenever you have free time, let us know, and we'll try to pitch in,
Yeah.
be your guinea pig.
And it seems like we've got the technology almost sorted now, so
Yeah.
we seem to be going okay. Today was a lot less painful, wasn't it, Christy?
Yeah.
Beautiful. All right, girls.
Well,
Oh,
I'd like to just say
Thank you.
too.
sorry, Kelly. What was that?
Oh, I just wanted to say thank you too. And I have some new things to focus on and try, so I'll keep at it.
Oh, excellent. Oh, well, thank you very much, girls, and thank you for joining us, and hopefully see you in the future, and definitely see you on the board.
Yeah. Thank you.
Okay.
Thank you. Okay, bye.
See you later.
Bye.
Bye.
Bye. Bye.